Our topic for the debate was healthcare entitlements. Our question was, should Americans be entitled to healthcare? A lot of people don't know what healthcare entitlements are. They are a healthcare program to which certain people are entitled, and entitled is believing oneself to be inherently deserving of privileges or special treatment. We support the notion that healthcare entitlement should be turned into a state-run block grant program with a fixed federal contribution because government provision of health would lead to larger government debt and deficits. There are many entitlement programs in the U.S. One is Medicare, which provides healthcare for elderly Americans. Another is Medicaid. Medicaid provides healthcare to low-income Americans. An example of Medicaid is the Children's Health Insurance Program. Social Security is another entitlement program which provides retirement and disability benefits. Unemployment provides benefits to working-age adults who are out of work, and welfare programs are targeted to low-income individuals and families. In 2013, Medicare covered 51 million people, totaling $586 billion. Medicaid provided care for 62 million low-income Americans, totaling $265 billion. Social Security sent checks to 58 million retired Americans, totaling $809 billion. Expansion would increase the U.S. debt. According to the Congressional Budget Office, outlays for mandatory programs will rise to $2.4 trillion this year, an increase of $139 billion from 2015. Most mandatory spending is for the federal government's major healthcare programs and Social Security. Those healthcare programs consist of Medicare, Medicaid, and the Children's Health Insurance Program, along with federal subsidies for health insurance purchased through the marketplaces established by the Affordable Care Act and related spending. Federal spending on healthcare programs will more than double over the next decade, growing by $1 trillion from $962 billion in 2014 to $1.9 trillion in 2024. Medicaid expenditures are expected to increase to more than $830 billion by 2023. This chart shows that Medicaid is the fastest growing major entitlement when compared to Social Security and Medicare. Expansion would lead the U.S. towards a single-payer system. This means that the government will pay all healthcare bills, control distribution of healthcare services, determine availability of these services, determine the cost of services, control distribution, budgeting, and price setting, and set service restrictions. Expansion would also raise taxes. Coverage of costs from universal healthcare coverage will increase payroll taxes and increase tax revenue use. Rise in taxes will force the working population to subsidize healthcare for unemployed populations, and working populations will provide unemployed populations with healthcare entitlements free of charge. Expansion would lead to overuse of healthcare services. Influx of new patients will lead to shortage of resources, physicians, nurses, hospitals, and equipment. Covered populations will use healthcare services more than necessary, which could become a moral hazard. More opportunities for abuse and fraud will arise. Populations will be collecting more benefits than they are contributing, which will create a deficit. And longer life expectancies will increase demand for services and resources. Medicaid is the fastest growing entitlement program and will grow by 87% over the decade due to Obamacare's Medicaid expansion. Medicaid needs reform, not expansion. This program provides health care to more than 60 million Americans and consumes a growing portion of state and federal budgets. 44% of the projected growth in major entitlement spending over the next decade is due to Obamacare's subsidized and Medicaid expansion. Rising healthcare costs are projected to drive 13% of the increase. 43% of the spending growth in Social Security and the major healthcare programs will be due to population aging. Mandatory spending is projected to increase from $2.4 trillion in 2016 to $4.1 trillion in 2026, an average yearly increase of 5.5%. This is because of a growth in aging populations and healthcare spending per enrollee. Ultimately, this is an expansion of entitlement programs. Again, We support the notion that healthcare entitlements should be turned into a state-run block grant program with a fixed federal contribution because government provision of health would lead to larger government debt and deficits.